Is carnivore diet safe for a patient who has had a recent heart attack and or stent implant?
We have to realize that the carnivore diet is not a fad diet. It's not a new diet. It's basically what we have been eating as humans for millions of years. So for me, the proper question to ask is the food pyramid, is a diet that is heavy in processed food, which is what a low-fat diet that's typically recommended for patients with heart disease, is that a safe diet to be eating when you just had a heart attack or just had a stent implanted? And quite frankly, I think the answer to that is no. And carnivore, whole, real food, low carbohydrate, low processed food diets should be our default diet. And I see no reason not to recommend it to patients who, have had a heart attack recently or had heart surgery or had a stent implanted.
And next question, what are your thoughts on stents? Are there any downsides to them? And is the heart able to heal itself over time when one is eating zero carb in lieu of using stents?
Stents have been shown, the main benefit of stents have been shown when you have a heart attack or you are having low blood flow to an area of your heart, what we call ischemia, and you are having symptoms related to that, and you have a significant blockage. Stents have been shown to be beneficial in that situation. Stents are oftentimes overused in patients who are not having active symptoms. The medical term for it is what we call stable angina, or not having angina, not having chest pains at all. Certainly in the past, and there is a focus on this within the cardiology community, not to overuse stents in those situations. Can you undo blockages that have occurred in your heart? Can the heart basically repair itself if you suffered a heart attack and have an area that is damaged? These are both somewhat controversial questions. What I tell my patients who are coming to me, for metabolic health advice, and they have heart disease, but not advanced heart disease that they need surgery or stents or anything like that. I always tell people that our goal is just to stop the progression, not to build up more blockages in the arteries of your heart. I have had patients who have reversed some of their blockages as measured by coronary artery calcium scores. Again, that's controversial. Many people will say that that doesn't happen, but I have seen it in my patients. Many other physicians have reported it in their patients. So I do think it's possible, but I also tell people that as long as you stop the progression, you're going to end up, in a better place, and you're going to lower your risk of having problems from those blockages in the future.
What ways can patients with known heart disease improve their metabolic health?
The answer is no different for patients with heart disease or without heart disease on how to improve your metabolic health. And it's all the things we've been talking about, eating whole, real food, eliminating processed food, getting good amounts of activity throughout your day, lowering, dealing better with your stress is the way I always term it. We oftentimes can't eliminate stress, but we can find better ways to deal with it. Getting, adequate sleep, getting adequate sunlight. These are all the things that improve our metabolic health, and doing so, whether or not you have heart disease, really isn't any different.
And what things do you practice to deal with stress better?
I just try and be more mindful about it. And when I am getting stressed, I just try and do some deep breathing and relaxation. I don't really do formal meditation or anything like that, but for people who do, I think that's a great way to deal with it. One of the things that I have noticed in myself, and I notice in my patients, is as your metabolic health improves, you have a better stress response. You tend to be calmer. When your blood sugar isn't going up and down constantly on the roller coaster throughout the day, that just stabilizes, you mentally. And so I've just found, honestly, that as I've improved my metabolic health, I've gotten less stressed, or, I guess you could say I deal better with the stress. I still have the same amount of stress in my life. I'm still a busy heart surgeon with a family and running, multiple businesses. But I just seem to be able to deal with that better. And my patients find the same as well.